Thank you for attending this Understanding the 988 Lifeline System in Minnesota presentation developed by the 988 Coordination Program at the Minnesota Department of Health. Before we get started, I want to take a moment to talk about taking care of yourself. This session may cover some material that can be distressing or triggering. We have all been touched by loss at some point in our lives. If you are a survivor grieving a suicide loss, you are not alone. If you find the following information brings up painful memories, take care of yourself and seek support that would be helpful to you. Feel free to pause the video and come back to it later if needed. You're welcome to reach out to our 988 team if you need additional support. Our email will be available at the end of this presentation. The 988 Minnesota Lifeline program is part of the MDH Mental Health and Suicide Prevention Unit. Our unit's work involves a wide array of suicide prevention programming throughout the state, including youth suicide prevention, zero suicide, regional suicide prevention coordination, tribal partnerships, community grantees, suicide data and reporting, the Minnesota Suicide Prevention Task Force, and the Minnesota Suicide Prevention State Plan. The 988 Lifeline program involves overseeing grants with our Minnesota 988 centers, relationship building across the crisis care continuum, evaluation, tribal partnerships, and communications. In 2022, the National Suicide Prevention Lifeline transitioned to the 988 Suicide and Crisis Lifeline with a new 3-digit dialing code. The intent was to create a universal entry point for mental health-related support with an easy-to-remember number. 988 is centralized at the national level. This ensures that anyone who contacts 988 will receive the same quality of support. The hope is no matter where you live in the U.S., you can connect with a caring, trained specialist to help with any self-identified mental health-related concerns. The clinical standards, policies, and technology for routing 988 contacts are decided at the national level through the 988 Lifeline Administrator, and all 988 Lifeline centers must adhere to their requirements in order to maintain their status as a 988 center. States are responsible for ensuring the 988 system is operational and can respond to calls, chats, and texts. States may require additional policies and standards to the national standards, but this varies from state to state. 988 provides confidential listening and support via calling or texting 988 or chatting at 988lifeline.org. People can contact 988 for themselves or on behalf of another person. All people connecting with 988 are screened for suicide risk. A key component of 988 interactions is providing information and resources local to the person contacting 988. A benefit of each state and territory having their own 988 center is that their 988 specialists have the knowledge and resources to connect folks to local support. 988 provides mental health support but does not respond in person. If a person contacts 988 and needs a higher level of care, 988 can facilitate the transfer to an appropriate service or resource. 988 is not meant to replace mobile crisis teams, crisis stabilization services, 911 emergency services, or other dedicated hotlines. The 988 Lifeline Administrator develops core training materials for all 988 Lifeline centers. 988 Minnesota Lifeline specialists complete online clinical training courses, including fundamentals of crisis counseling, essential skills in crisis counseling, assessing safety and suicide risk, and determining imminent risk of suicide. They also complete a minimum of 8 live role plays, 2 simulated interactions, and 10 to 20 hours of live observation of experienced 988 Lifeline specialists. These are the minimum training requirements. Each center may offer additional trainings. MDH also recommends trainings including culturally relevant trainings like being a good relative from the Suicide Prevention Resource Center, Indigenous Historical Trauma and Cultural Humility Training, and the MDH-led Tribal History and Cultural Safety Training. Most centers in Minnesota have specialists go through 80 hours of training before they are ready for live observations. In most cases, a specialist has a month of training before they are ready to take 988 contacts on their own. This graphic outlines the oversight of the 988 Lifeline network. Individual states have oversight of local 988 Lifeline centers as their funder, and as previously mentioned, there is a national 988 Lifeline administrator that sets clinical standards and policies and does quality assurance for the Lifeline. There are 5 different lines that are part of the national 988 Lifeline network. The local line, which are answered by centers in each state or territory, 3 specialty lines answered by national centers, and a national backup line. There are over 200 local 988 Lifeline centers. Minnesota has 4 centers that answer our local line. These 4 centers are what MDH has visibility into when it comes to data. We do not have insights into data for the specialty lines or the national backup line. A common misconception is that anyone in Minnesota that contacts 988 will reach one of our 4 centers. The routing of 988 contacts is a bit more complex. The best way to explain this is to first discuss georouting. Georouting is the process of routing contacts based on approximate location instead of area code. Right now, around 70% of wireless calls, those on the Verizon, T-Mobile, and AT&T networks, are georouted. Smaller carriers must implement call georouting by December 2026. Additionally, at this time, texts are not georouted. The FCC has adopted rules for text georouting, requiring the major national wireless carriers to implement text georouting by April 2027 and the smaller carriers by October 2028. Even with georouting, our 988 specialists do not receive any location data other than the phone number connecting with them if their system allows. Which leads to another common misconception that 988 can view someone's location and tell 911 where to dispatch EMS or emergency rescue services. This is false. 988 is not able to do this. If someone requires emergency rescue, they will be transferred to 911 who can determine someone's location. This chart shows how 988 Lifeline routing works for calls. When a person calls 988, they hear a greeting message that welcomes them to the 988 Lifeline. In Spanish, the recording prompts the caller to press 2 to reach the Spanish language network. The recording then prompts veterans, service members, or people calling about them to dial 1. The final portion of the greeting message says to press 0 or stay on the line to be connected with a 988 Lifeline specialist. The help seeker can press 0 at any time during this greeting message to be connected with a 988 Lifeline specialist immediately. The call is then geo-routed if coming from a major wireless carrier or routed based on area code if coming from a smaller carrier. Major wireless carrier calls coming from outside of Minnesota will be routed to the 988 Lifeline Center answering for their area. If the help seeker is located in Minnesota, the call will be routed to the 988 Lifeline Center covering their area. That center will have 120 seconds to answer this call. If they are unable to answer, the call will be routed to Minnesota's in-state backup center. That center also has 120 seconds to answer the call. If they are unable to answer, the call will get routed to a national backup. Minnesota's average speed to answer for calls in 2024 was 19 seconds. Help seekers with a Minnesota area code on a smaller wireless carrier will follow this same routing process regardless of if they are physically located within Minnesota. Help seekers without a Minnesota area code on a smaller wireless carrier will be routed to the Lifeline Center answering for their area code. Let's take a look at what happens when you call 988. First, you'll hear that greeting message that gives you service selection options. Callers can press 0 at any time to bypass the greeting and be connected with a specialist. The message will direct help seekers seeking services in Spanish to dial 2, and service members, veterans, and their families to dial 1. Hold music will play while you are being connected with a 988 specialist. The specialist will answer your call, screen for suicide risk and assess your safety, provide support, and share resources that may be helpful. Third-party interpretation services are available in over 200 languages. Unlike 911, 988 does require active phone service to connect. This graphic shows how 988 Lifeline routing works for texts. Texting anything to 988 will prompt a welcome message. Texting IUTA to 988 will connect with the Spanish language network. The Veterans Crisis Line can be reached at 838-255. Otherwise, people connecting with 988 via text can type NEXT and be connected with the 988 Lifeline Center answering for their area code. If the help seeker is using a Minnesota phone number, they will be routed to one of the 3 988 Minnesota Lifeline Centers answering texts. These centers have 120 seconds to answer the text. The average speed to answer for texts in Minnesota in 2024 was 17 seconds. If the centers are unable to answer, the text will be routed to a national backup center. These screenshots show what happens when someone texts 988. Any mobile device that can send and receive texts can be used to text 988. Texts are still routed by area code. The message will direct help seekers wishing to connect in Spanish to respond Ayuda and redirect veterans and service members to text 838-255. Texting next will prompt the suicide screening questions. While these screenshots show a sample of what might be asked, each Lifeline specialist has a unique style and may ask questions in a slightly different format. The service received will still remain the same. And as with calls, a phone must have active phone service to connect with 988. This chart shows how routing works for chats. When a help seeker visits 988lifeline.org, they will be presented with a pre-chat survey. A link at the top of the survey directs veteran service members and their families to the Veterans Crisis Line. In the upper right-hand corner, help seekers can toggle the language from English to Spanish to connect with the Spanish language network. Help seekers wanting to connect with their local 988 line should stay on the main page and fill out the pre-chat survey. 988 chats are routed by the zip code the help seeker enters into the survey. Minnesota zip codes entered are routed to Minnesota Lifeline centers. Some help seekers choose to enter a zip code like 55555 for privacy reasons. However, the 55555 zip code exists in Minnesota, so we get those chats as well. Centers have 120 seconds to answer the chat, and the average speed to answer for chats in Minnesota was 14 seconds in 2024. If there is no answer, the chat will be routed to the national backup. This is a screenshot of the pre-chat survey. It is web browser based and works whether the help seeker is connecting on a mobile device or desktop. The pre-survey is required before the chat will be routed to a Lifeline specialist. There is a hyperlink for veterans and service members to connect with the Veterans Crisis Line at the top of the survey. In the top right-hand corner, the language can be toggled between English and Spanish. As you can see, the 2 suicide risk screening questions are included in the pre-chat survey. Though the Lifeline is called the Suicide and Crisis Lifeline, it's important to note 988 is available for all kinds of self-reported mental health concerns. This list shows some help seeker-defined reasons for connecting with 988. People reach out for many reasons, including anxiety, depression, loneliness, anger, substance use, and life stressors. Let's dig a little deeper into how Lifeline specialists work to assist help seekers with their concerns. 988 specialists take a 3-phased approach in all interactions regardless of contact method. Phase 1 focuses on connection and immediate safety. Phase 2, the longest phase, involves active listening, asking clarifying questions, and helping the help seeker develop a plan to create their own safety. Phase 3 is the wrap-up phase. Let's dig a little deeper into what these phases may look like. Phase 1 focuses on establishing connection and immediate safety. The 988 specialist will work to identify the reason the help seeker has contacted 988 and will work to establish rapport with the help seeker. For calls, this is the phase where those screening questions we saw on the chat and text slides will be asked. The specialist will ask if the help seeker has had any thoughts of suicide in the past few days, including today, and if the help seeker has taken any action to harm themselves today. A yes to either question prompts the specialist to conduct a full safety assessment. They will ask questions to help identify desire, intent, and capability. These will be questions about feelings of hopelessness and access to lethal means. The specialist will also ask about any buffers. This looks like asking about pets, family members the help seeker may talk to, or even things like TV shows they might enjoy watching as a distraction. Phase 2 is the longest part of the conversation. The 988 specialist will ask further clarifying questions about why the help seeker is contacting 988 and listen to their story. They will engage in active listening, continuing to ask clarifying questions. The goal of this phase is to assist the help seeker in creating their own safety through the least invasive interventions possible. This safety planning process will ask further questions about professionals the help seeker may already be working with, if they would like referrals to local resources like their local mobile crisis team, any coping mechanisms that have helped the help seeker before, any friends or family members they can contact, and a plan moving forward if they need help again. This process is intended to empower the help seeker while giving them local resources and options they might not have been aware of to achieve safety going forward. In the wrap-up, the specialist will review this safety plan and ensure it is something the help seeker feels comfortable with. Any help seeker connecting with 988 who is experiencing suicidal or homicidal ideations is offered follow-up services. These services, they're not required to accept these services, but the services are offered. Follow-up occurs within 24 to 72 hours after the original contact with 988, and services are typically short-term. If long-term ongoing support is needed, the specialist may facilitate a referral to a local provider like a local mobile crisis team. The specialist will again ensure the help seeker's emotions are de-escalated or stabilized and that their concern has been thoroughly addressed. Some demographic information may have already been disclosed throughout the conversation. When the 988 specialist is providing referrals, this may come up as well. If not, at the end of the conversation, the 988 specialist will say something like, "Before we wrap up, would it be okay if I asked you a few questions about yourself? These questions help us better prepare for serving those who use 988. If the help seeker agrees, they will ask the demographic questions. Demographic information is collected to tailor resources, evaluate the reach and needs of the program. For example, it informs our communication campaigns and fulfills community requests and funding requirements. Every 988 help seeker receives a caring response, safety assessment, and assistance de-escalating any current concerns. A conversation is often the only intervention needed for 988 help seekers, but many help seekers also benefit from referrals to local services. Occasionally, it becomes clear a help seeker needs immediate assistance from a higher level of care, and the specialist will facilitate a warm transfer to that higher level of care. A warm transfer refers to the process of a 988 specialist transferring a help seeker to another organization or service while prioritizing continuity of care. The opposite of a warm transfer is a cold transfer, in which a caller is simply patched through to another center without explanation or communication. Warm transfers require consent from the help seeker and are typically facilitated to their local mobile crisis team. That said, occasionally it becomes apparent a help seeker will need immediate first responder intervention in connection with 911. Again, 988 uses a least invasive intervention approach, meaning 911 is only contacted if there is a risk of harm to self or others imminently or in progress, and a less invasive plan for safety cannot be collaborated on because the help seeker is unwilling or unable. The 988 specialist will still work to get consent from the help seeker to connect with 911, but will connect without consent if those two conditions are met. Involuntary methods are always considered a last resort. In 2024, 681 contacts were transferred to 911. That amounts to 0.8% of all answered contacts. Minnesota Lifeline centers do not receive information following transfers to 911. The 988 Lifeline Administrator conducts quality monitoring of all 988 centers' interactions. If a 988 specialist performance falls below established expectations, the 988 Lifeline Administrator works with the 988 Center to fully address the identified concerns. This may include removing the 988 Lifeline specialist from handling interactions. You can provide complaints, compliments, or other feedback about your experience with the 988 Lifeline by using the 988 Lifeline Contact Us form. It can be found at 988lifeline.org/contact-us. Thank you for attending this training. If you have any questions, please feel free to reach out to us at health.988lifeline@state.mn.us.